the squeeze technique for a stiff neck. This is just general information. If you wake up in the morning all of a sudden with a stiff neck, or if you've had a long day at the office, head down over a computer or bookwork, and then you're really feeling it when you come home. So this is just general information for those general aches and pains. If you've got real pain or unusual pain in your neck or shoulders or your head, you should always consult your medical practitioner. So, the technique consists of actually 5 parts. So part number 1 is actually squeezing the shoulders. Now when you have a sore neck, usually you're sore into one particular side the most. Now you can, if it's for example, my left side here, you can just bring that shoulder up slowly and squeeze it and hold and squeeze for about 10 seconds. Squeezing, squeezing, squeezing. Your aim is to fatigue the muscle. Now, if it's really sore, and then gently relax the shoulder down. If it's really sore though, you might actually need to do both shoulders. Squeeze, 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 fatiguing, tiring out the muscle. Squeeze, squeeze, squeeze. 10 seconds or so, and then just gently let the shoulders relax and come down. Okay, so you can do that a couple of times, but never squeeze into pain. Be gentle with yourself. Okay, the aim is just to tire and make the muscle relax. We're then going to do the second part of the technique is to turn your head to the side. So turn maybe to your better side to start off with. So just slowly turn to wherever comfortably you can go. Hold for a couple of seconds and then come back slowly to center. Then you go to the other side, slowly. Slowly always for a stiff or sore neck. It responds better that way. So just slowly turning to where you can comfortably go. Hold it for a couple of seconds and then come back to center. So you can actually do that 2 or 3 times. And you're just gently getting the muscles moving, gently warming up and getting circulation to the area. The third part of the technique is to come to the trapezius muscle, which is this big fleshy muscle, which actually has large connections into the back of the neck, also the shoulder, into the back, between the shoulder blades. Trapezius muscle is actually a problematic muscle. It can cause a lot of pain for a lot of different conditions. But for the neck, what we're going to do is access it at the most easiest part, this sort of fleshy part here. Feel around. There may be some sore spots. May not be. If it's been tight for a while, it can actually go numb. And so you might just feel hardness. So you find the sorest spot or the numbest spot. And it's a simple little move. If you've got strong fingers, you might just want to use one finger. I find for me and for most people, 3 fingers together gives you more strength. So you hold on that spot and then gently pull it down and to the front 3 times. So if this is the trapezius muscle, the move is 1, 2, 3. And that starts to release those large muscle fibers. With your stiff neck, you might have a little bit of stiffness to the other side. So you can also do it to the other side. Find that large fleshy part, find a tender spot, and then 1, 2, 3. Then just relax. Take a few nice deep breaths. We want to change your breathing from tight up in the upper chest and stressed into more relaxed, deep belly diaphragmatic breathing. So between each of these sequences, just take a few deep breaths and just relax. The next thing we're going to do is a neck tilt to the side. Again, this is all stretching the usual culprits, the main muscles that will tend to give you a stiff neck. So we're going to turn to this side just slowly and feel a stretch in the muscles on this side. Just hold that stretch for a good 10 seconds or so. Now, if your neck has been really problematic and causing you a lot of pain, you don't want to come out of that stretch by yourself. So you can actually just use your hand and just gently start it back, coming back to center. We're going to now do that to the other side. So just turning to the side. So this is your problematic side. You may not be able to go as far, but just go to your comfortable extension. Just go to your comfort level and just let it hold there. Just take some deep breaths. And just let it stretch and extend. Again, using your hand. If you need help back, the worst thing you can do is stretch a muscle, elongate and relax the muscle, and then jerk it back into action to bring it back to center. So movements are slow, controlled, and if you need a little bit of help bringing your neck back to center, do it. Okay? Excellent. Now, beside the trapezius, one of the other main muscles that can cause a lot of neck problems is your SCM. Sternocleidomastoid muscle for short. We call it SCM. So you can grab that muscle and gently kind of rotate and squeeze, kind of massaging as you go up the neck. Now this muscle attaches at the collarbone, comes up and attaches behind the ear. So grab the muscle, gently squeeze and rotate. Don't hurt yourself. Always be gentle. That's the first step for the SCM. The second step is again with these fingers. It might be one finger, might be 2 or 3 fingers. We're going to do some cross fiber mobilization. So what we're going to do is get to the back of the muscle and gently pull it forward. Then go all the way up the neck. You can do that a couple of times, starting at close to the collarbone. Okay. And of course you can do those things on the other side if you need to. Sometimes it's good to do both sides of your neck and do preventative work as well. If you feel, do these moves before you get really stiff and sore, and often you can postpone it ever developing. So now we have the fifth and final part of the squeeze technique for a stiff neck. And that's actually using your hands or your hand. It's an acupressure point or acupuncture point, large intestine 4. So on your hand, you squeeze together your thumb and your index finger, and you're going to get a little crease when you do that. At that point, you squeeze in against the bone of the finger. And there's a little indent or a little groove. Usually or sometimes it can be a little bit tender. Now you can actually squeeze or hold that point with your index finger. My clients in clinic though find it easier to use a pincer grip and to sort of squeeze in against the bone there. You can use your index finger or your middle finger, whatever's easiest for you. So squeezing into that groove against the finger bone, or you can just hold it, or you can squeeze and pulsate, or you can rotate on that point. So whatever way is convenient and comfortable for you. With reflexology, we work with zone therapy, meaning that if your neck is sore on the right-hand side, you do the right hand. If it's sore on the left-hand side, you'd actually work the left hand. Sometimes, though, with acupressure, you can go crossways. There's fascia and tissue across the system that crosses over the body. So sometimes it makes sense to do both sides. So if in doubt, do both. You're not going to hurt anything by doing both sides. So that's the 5 parts of the squeeze technique for a stiff neck. Now, usually when people do that, they will have quite substantial relief with their sore neck. If you've got a little bit of relief but still quite sore, you need to just take a couple of deep breaths and go for a walk. Leave it alone for 10 minutes, half an hour, even an hour. Go and do something else. Have a big drink of water. It's important when you've got pain to stay hydrated. So good water, a bit of a walk around, forget about it for a little while, and then come back and try it again. Some people get a lot of relief from doing it once. Some people need to do it 2 or 3 times to get relief. But if ever you get to the situation where your pain intensifies or is growing, always go and see your doctor. Okay. Well, thank you for listening. And I hope you're living your life pain-free.